Hello India, very good afternoon to all of those who are watching me live on the Facebook page of News9. I'm Neha and today we will be talking about the World Health Organization, which has praised India over its handling of COVID-19. So the World Health Organization has praised India, saying the country took enough measures to contain the spread of virus from the very beginning and also responded with utmost urgency to coronavirus. The WHO, while hailing India over tackling of the crisis, stated that, in fact, the WHO Regional Director, Southeast Asia, if I have to speak about Poonam Singh, stated that India ramped up its testing and, of course, testing capacities. He also said, and I quote, India is responding with utmost urgency to COVID-19 from the start. India has been continuously strengthening preparedness and response measures, including ramping up testing capacities, readying more hospitals, arranging and stocking up medicines and essentials. He further added that India took bold, decisive and early measures earlier in the outbreak. The country did not witness an exponential increase in cases like some other countries, which reported their first few cases along with India. Like in any other country, the transmission of COVID-19 is not homogeneous in India. So there are areas yet to see a confirmed case. Some have sporadic cases in some areas, some small clusters, while we are witnessing large clusters in some mega cities from the densely populated areas. On the other side, of course, on one side you have WHO praising India over its tackling of COVID-19 crisis. But on the other hand, if we have to talk about India, today crossed a grim milestone of 12 lakh mark with highest single day spike of over 45,000 cases just today. So over 29,000 people have lost their lives so far to the pandemic. If we have to speak about many other states, of course, Maharashtra continues to remain the worst affected and continues to top the tally when it comes to the worst affected states due to COVID-19. Following it also has Delhi, Gujarat, Rajasthan, Uttar Pradesh. But I would like to talk about Karnataka in particular, which is currently at the 4th spot when it comes to the worst affected states due to COVID-19. But it might be, in fact, on one side you have Karnataka on the 4th number when it comes to the worst affected states. But on the other side, in Karnataka, you have the 3rd highest active cases. But even after that, the state government has decided to not impose the lockdown. But not a similar sight can be witnessed in various other states as well, where the respective state governments, for example, Bihar, Kerala or, Assam or several other states where we've seen lockdown has been imposed, including Uttar Pradesh, to contain the spread of coronavirus. So the WHO says that, it's great that India was able to contain the spread of novel coronavirus, as initially it did not see a steep increase in the number of cases. But how much of is it true? Let's find out, because joining me over the phone line is Professor Puranik. Thank you very much, Professor Puranik. Good afternoon to you. Now, do tell me, what's your observation of WHO's statement hailing India over handling of COVID crisis? The WHO thinks India handled the situation pretty well. So does WHO's statement hold any water considering the rising number of cases?
Well, Neha, it is a kind of consolation for people of India who are going through this worst crisis. WHO, if the regional people say that, that is under control. But I'm also told that India ranks number 2 after USA in testing and providing a kind of medical assistance, immediately in the overall context of the nation. But as you mentioned about the position, that India it was 10th, about 2 months back. Now it is number 3 after US and Brazil. So I think, these things have to be, holistically, we have to, review this situation. So I would say, compared to the 130 crore people that we have, the percentage is okay, under control. It is not, as you said in the beginning, it is still, we have not reached the exponential crisis as such. But the kind of unpreparedness in the beginning was exposed so badly, and the migration of laborers and disruption of economic and other kinds of normal life, all of them created a kind of real panic. The pandemic and panic, they, I think, have been seen by Indians and even from outside. I think that was the peak last month. I think if these things are done, probably, if you take the protocol and guidelines of the World Health Organization, which did not do it properly in the beginning, now
Right.
itself, better late than never, they have come to assess the situation and
All right,
all that.
but Professor
therefore,
Puranik,
I would say, and on the All India point of view, this could be a good sign, a kind of rare hope.
But
India, with vast population-
but Professor Puranik, India's COVID-19 graph continues to move in the upward direction. While
Yeah,
this is on expected lines, does it look like India so far has handled the situation well?
No, see, I don't say we have handled it properly. The other day, Dr. W.H.O, who was there in the task force in the beginning, he said, beds don't treat patients. You may have created more beds and all that. Where are the logistics? You have not been able to provide it. Take the case of Karnataka itself. You have beds and people are not admitted. Even asymptomatic patients are denied a kind of medical assistance from the private medical hospitals. So if government hospitals are overcrowded, the private hospitals in Karnataka have failed miserably. They have not kept up their ethical or kind of moral commitment, which they professed before the chief minister when he for a meeting and all that. So these contradictions are there because, Neha, we are a data poor country. We only talk on the basis of some reliable or credible information. India started well in the beginning with the lockdown, the symbolic kind of administrative situations and all that. But lockdown for up to June, okay. Afterwards, people thought of economy, development, and dislocation of life and all that. So therefore, we are a poor country and we are not prepared to meet this kind of situation even when US is not in a position. Compared to Brazil, I think, we are in a better position. But
Professor Puranik, we might be in a better position. That doesn't really mean that, the threat has subsided. So would you be able to tell me where actually India is faltering in its attempt to check the spread of virus?
See, I'm not a medical expert, but as a concerned observer, I would say that India has really make a war footing. In the beginning, I did write to the Prime Minister asking for national health emergency. Second thing is, you must provide insurance for all the people of India. If you take the number of cases reported, all that is, I think not even up to 10%. So when such is the situation, when you have all the money wherewithal, why you not providing the health insurance? The moment a patient is identified as a COVID patient, suspected, I think he should be taken care of, because we should not hand over these things to the private people and it should be subsidized, like the gas subsidy and many other things that the government is planning. Because this is a real, it's survival of the people, now or never. So when the death rates are under still control, you said about nearly 30,000 it is reaching and all. So therefore, now it is the writing on the wall that, you are under control. If you don't provide facilities all over the state. Second point is the federal system itself, I think it has to join together, cooperate with the health protocol. That is not happening. Each state is trying to go on with experiments and all that. That will not happen. Take the case of Karnataka itself. They had lockdown and then they relaxed it, numbers increased and all that. So that means you have not been able to pin down where exactly the patient is there. You have GPS, you have Google Search, and many other technological advancements, but you are not. That's why Professor Dr. Devi said, merely providing 10,000 beds, you are not going to solve the problem. You must catch the patient at the early
and we might want to criticize the state government or the central government over its handling of COVID-19, but we really cannot, not talk about the fact that a large part of it also depends on us. As a citizen of the country, we must take all the preventive measures. The health experts also are saying that if at all we take all the preventive measures, we can actually go on and live a normal lives like we used to, earlier, before COVID-19 pandemic.
Ultimately,
so a large part of it depends on us as well. Don't you agree?
And that the message is that each person who steps out of the house, he should know now why he is going out during this particular crisis. Whether lockdown or no lockdown, people have not been really following. They think that I am safe and probably others are suffering. This kind of carelessness and irresponsibility on the part of people who are, on the streets for nothing. This is the thing. That's why even the first 2 months, you see how beautifully the medical corona warriors, they served the country, they helped. Now they are also under restriction. So we don't have alternate people, alternate arrangements. We don't have doctors. I think, this treatment can be given by mere MBBS doctors or
All right.
earlier, as I mentioned, LMP doctors and all that. So because,
All right.
it requires. It requires because it's a very serious infection. And in the beginning, if you control it, I'm sure, as you said rightly, people are ultimately responsible.
All right,
Because
Professor Puranik. I get your point, Professor Puranik. Thank you so very much for joining me on the Facebook page of News9. Well, for all of those who are wondering, yes, now WHO also has praised India for its handling of the COVID-19 crisis. But do remember, as I just said, a large part of it depends on you as a concerned citizen of the country. It's not for anyone else, it's for you and your loved ones. Thank you so very much for watching for watching the Facebook Live of News9, and thank you so very much for joining me as well. Take care of yourself, and do not forget that you must take all the preventive measures. If at all you like this video, do not forget to subscribe News9 YouTube, like us on News9 Instagram, Facebook as well as Twitter. Thank you very much. Take care.